Okay, good evening, everyone. I'm Dr. Sunita from Malaysia. Let me give you an overview of Precision Probiotics. I'll do the presentation and Dr. Leroy will be taking the questions. Next. So what are probiotics? We were told that probiotics are like microorganisms which may be beneficial to our health. I'm here to tell you that probiotics are not beneficial. It is vital to our health. Next. So a probiotic is actually a live microbiome and it feeds on the prebiotic or the food which we eat. The probiotic will consume the foods which we eat to produce a metabolite which is vital to our health. Next. We have probiotics everywhere. We have them on the skin, in our gut. We have it everywhere in the body. The reason why we call the gut the second brain, because we have the most number of microbiomes in your gut. 95% of all microbiomes are in your gut. Next. So you have trillions of microbiomes all over your body, which is a combination of bacteria, fungi, protozoa and viruses. These microbiomes digest the food to the simplest form to produce metabolites which are vital to sustain life. Next. Why are these probiotics so important? It is because of the immunomodulation aspect that we need to consume the correct probiotic for the correct diet which you are consuming. Next. So now that you understand probiotic is needed, which one do you think that you need? That is the key question to the presentation today, that probiotics have got different strains. Next. So you have got the lactobacillus, you've got the bifidobacillus, you've got so many probiotics. What actually do you need? Next. The reason why we need a variety of probiotics is because the microbiomes are in axis with all the organs in your body. That means that the gut has got a gut-brain axis, a gut-heart axis, a gut-lung axis, a gut-skin axis, and it supports your metabolism. Each microbiome has got a specific strain which will support one function of your body. Next. So each microbiota will produce one single metabolite which will be able to sustain the function of your body. Next. I give you an example. Okay? We all eat eggs, but we don't understand that this egg has got something called lecithin. Unless you have the microbiota which can convert lecithin into phosphatidylcholine, it is useless for you. Why? Because phosphatidylcholine is used for cleaning out the soft plaques within your arteries. So unless you have phosphatidylcholine in its basic form, you will not be able to clean the plaques from your arteries. So it is so important that when you eat eggs, you have to have the specific microbiota that is able to convert the egg or lecithin into phosphatidylcholine. Next. So these are the probiotics which we have in nature, which we have been able to identify. Next. You must understand, when we speak about probiotics, there is a genus, there is a species, and there is a strain. So we all know lactobacillus, we all know bifidobacillus, but we don't understand that there are specific strains, and each specific strain will produce one single metabolite to sustain one single function. Next. So each specific probiotic will be able to reinforce each function. I give you a very good example. We had COVID. Some of us got COVID, some of us didn't get COVID. Dr. Patana was very good that he didn't get COVID. But how is it that some of us never got COVID? Most of the time, if you understand probiotics after this presentation, you will understand that each strain produces a single metabolite. So, if you have been eating cheese, especially blue cheese and cheese have got the probiota, which is able to maintain the gut-lung axis. And those who had the microbiota with the supplements or whatever else that you've been taking, that microbiota was the one that was able to support your gut-lung axis, hence you did not get COVID. Next. So, probiotics are like bacteria. It feeds on the food which we eat and it produces a postbiotic or a metabolite that we are able to use by the organs. The combination of this is what makes our immune system strong. Next. So, next question is, how do I supplement these probiotics? Let me just tell you a small thing. We have 40 trillion microbiomes in our gut. If you understand 40 trillion microbiomes, we cannot supplement probiotics. We have to consume the foods which have the probiotics that is able to ferment in our gut to support the gut microbiota. We can supplement, which we do, but it is only for acute cases. And once you overcome that disease, to maintain the microbiome in your gut, you need to eat the correct foods. Next. So why is it that we have this problem? We have a lot of problems. We have microbes. We have our famous medications. We have stress. We have diet. We have aging. All these factors point towards a gut dysbiosis. Next. So the efficacy of the probiotics in your gut is host-specific and strain-specific. Next. How do you know that you have a problem? How do you know that you have a problem with your microbiota? If we are unable to test, then we look at whether we have a disease. Any disease or symptoms in your body that you have to correct your microbiome first. So once you are able to correct this microbiome, you will not have a disease. So correction of your symptoms or any disease or any imbalance lies first in the gut. Next. So we bring the gut into balance. What is balance? Balance means you need 85% of good bacteria versus the bad bacteria. There's no such thing as I need more good bacteria, I need less bacteria. No, it has to be in balance. You cannot have good bacteria only or bad bacteria only. You have to maintain a balance. That's why we supplement the probiotics, because we want to maintain this tandem of balance. Next. So once you consume the probiotics, you want to know whether it's working. You bought a bottle of probiotics, you started to take it, and you want to know whether it's working. How do you know whether this probiotics is working? You have to see the reason why you were supplementing the probiotics in the first place. Let's say you were having a skin problem, eczema, psoriasis. Let's say you had acne, you have PCOS. Everyone will tell you you need hormones, you need everything else. Yes, you do. But you also need to make sure the gut is balanced. Unless you balance the gut microbiota, you will not be able to overcome any symptom that you have. Next. So, I can't afford probiotics, or I'm far away from Jakarta, I'm somewhere else. How do I get my probiotics? Very simple. We have lived on earth for so long. we've been getting our probiotics from the food. Any carbohydrate food which undergoes fermentation will have probiotics. And it is that probiotics that will supplement the strains in your gut. Next. So probiotic foods are always foods which have been fermented. Why fermentation? Because fermentation activates the microbiome spores into live bacteria. And these live microorganisms will last anywhere between 4 to 7 days in your gut. So now you understand you need to replace or you need to consume probiotic foods on a daily basis so that there is diversity in your gut. Next. So overall picture, we need the microbiomes. The microbiomes come from the carbohydrates which you are eating. It can be anything, any carbohydrate that is fermented. And why we need to have these fermented carbohydrates is because we need to maintain the gut axis. Any disease you see, you need to maintain the gut axis first. Next. So, comes to the question, is a ketogenic diet good for you? Short term, if you want to lose the weight, if you want to overcome the disease, you want to correct the visceral fat, agreeable. But long term, you need at least 10% of your diet in carbohydrate form because it's only with this carbohydrate that your probiotics will be able to be replaced in your gut. Next. So now that you understand we need a balanced gut, what is a balanced gut? It needs to achieve 85%. It needs to be in total bacterial count, and it needs to be diversified. Each probiotic will have one strain. Each strain will produce one metabolite. So if you understand that, you need to also understand you will need to eat 50 to 60 servings of carbohydrate per week. Next. So these microbes are the ones that will digest the food that you are eating into the simplest forms to produce the metabolite which is vital to health. Next. Thank you. So now that you understand the overview of probiotics, let me pass over the mic to Dr. Leroy. Dr. Leroy is the person who makes most of the probiotics in India and in Malaysia. Any questions you have, any doubts you have, please be my guest. Hand over to Dr. Leroy.
Yeah. Thank you so much.